So what are the general risks of cancer treatments on fertility?
There are a variety of risks depending on the treatment you have. Certain treatments like surgery, for example, if you're doing surgery to the ovaries and the uterus or to the testicles, that's actually going to have a profound effect. Radiotherapy, again, if it's in an area that does affect the ovaries or the uterus, again, will have a profound effect and cause infertility. Things like chemotherapy, we're not quite so sure of the impact, and for some women and for some men that can cause infertility, but there is no specific guide, and different chemotherapy drugs are different, and there are a lot of other factors that we need to take into account.
Okay, thank you. Does the age of the person have an impact on whether the treatment is going to affect fertility?
The age of the person has quite a significant impact, particularly in women. The sort of general rule is if you are under 35 when you have chemotherapy for breast cancer, there is a 50% chance that you will not go into premature menopause. Well, I suppose a 50% chance you will go into premature menopause. As you get older, so women who are in their 40s, there is a much more significant chance that they will go into premature menopause due to the fact that their natural fertility is getting less, so the impact of the chemotherapy means that there will be a more significant and profound effect.
Yeah. Are there other cancer treatments other than chemotherapy, radiotherapy and surgery that have an impact on fertility?
There's all these new treatments out now, the monoclonal antibodies and things, and even some of the newer chemotherapy drugs, we don't really have a clear idea because we haven't been using them for long enough. Yeah. And these we're not going to see until the people who were having them 5 or 10 years from now are now trying to conceive, and we'll see what the impact is then.
Okay. Are there any key questions that you think would be good to ask your team at the start of, when you've been newly diagnosed, surrounding fertility? What are the kind of the key questions that you would say you should raise if you are worried about your fertility and how the treatment might affect it? What kind of things should you be looking to ask the professionals?
They're very simple questions. What is the impact of my treatment going to be on my fertility? Because people think, obviously, when someone's having surgery to their uterus or their ovaries, they don't think in the same way when they're having chemotherapy for a completely different cancer.
Sure. Yeah.
So definitely just asking what would the impact be, and also that is the point, and to ask and what can be done about that.
Yeah. Okay, thank you very much.